The name is Sensely and is one of such example of virtual nurse that implements natural language processing, speech recognition, machine learning, and wireless integration with medical devices such as blood pressure cuffs to provide medical assistance to patients. There are a lot many things in which Sensely is working. So moving forward, if you got the right hint, then we are here for a fireside chat. And we have two eminent speakers who are having ample experience in their own forte. The topic is applications of data science and artificial intelligence in healthcare. Healthcare is one of the most critical sectors in the broader landscape of big data. Artificial intelligence can assist doctors, nurses, and other healthcare workers in their daily work. AI in healthcare can enhance preventive care and quality of life, produce more accurate diagnosis and treatment plans, and lead to better patient outcomes overall. And to conduct the session or to be a part of this fireside chat, we are having Dr. Jaideep Jesson Rayapudi, Senior Subject Matter Expert, AI in Health Tech, iMerit Technologies. Dr. Jaideep Jesson, MBBS MD, is an expert in healthcare, AI development, and digital transformation of medicine. He currently serves as a consultant and senior subject matter expert in healthcare AI at iMerit. Dr. Rayapudi has taught medical physiology for 20 years at various medical schools, starting his teaching career at his alma mater, Christian Medical College, Ludhiana in North India. Then we have Mr. Mohar Manohar Mishra, co-founder and CTO in Inovaare Corporation. Mr. Mohar Manohar Mishra has rich experience of around 23 years in the area of analytics, software development, big data solutions, and cloud computing. He has co-founded Inovaare Corporation, a company that provides end-to-end healthcare solutions. Can I give a round of applause for this eminent speakers we would be having here in Fireside Chat? Topic, once again, application of data science and AI in healthcare, which is one of the most critical and vital sector. Please, sir, both of you.
Hello, everybody.
Hello, good morning. I hope you had a good tea break and you're refreshed and ready for this, listening to us chatting. And it's nice to be in a cool Bhubaneswar, and we really wish there was some fire to keep us all warm, but I think the warmth from the audience will get the fireside rolling. So great to have you here with us, Mohar, and first time for me in Bhubaneswar, and you're from Bhubaneswar. So why don't you just kick off by sharing, your background and what you do, and what are we going to talk about?
Thank you. Bhubaneswar is always, not always very cool like this. So welcome to Bhubaneswar. This is the right time, and keep visiting. And there's such a wonderful ceremony going on over here. Thank you very much for this opportunity. I wish I could attend something like this every year, every quarter. So thanks to NASCOM for something like this. I see quite a few familiar faces, quite a few friends with whom I grew up over here as an entrepreneur. So for people who don't know Inovaare, we founded this company sometime in 2014, early. And this is one of those very few companies, I would say, who are working in pure products. We work product and solutions in the US healthcare sector. So far we haven't branched out to anything else. Our focus is only on healthcare. And everything that we have done over here, starting from development, getting into sales, conceptualization, everything, we have done from Odisha. And we are competing in the Silicon Valley. Today we have 6 out of top 200 Fortune 200 companies. They're running their healthcare compliance on us. So
Nice, nice. That's really great. And yeah, it's a big round of applause, right?
and I have got tremendous support from the city, from quite a few people sitting over here, and of course my team who's sitting in the back as well.
Nice.
So a big thank you to Bhubaneswar for this.
Good, really nice. So, incidentally, even iMerit, where I work, we have an office here in Bhubaneswar. We have a center here. I think about 800 people work. We are working with data annotation. My role in the company is as a medical doctor. Like it was mentioned that I have been teaching in medical college for a long time. But I always, as a medical practitioner, our endeavor is always to bring the best possible, treatment, whether it's a medicine or a technique or a technology like digital health for the patient care. So in that endeavor, as I started learning more and more about AI, I slowly left that whole system. And now I'm working with this beautiful startup, which is 12 years young. And we work with data, all types of data solutions. And with 5,000 employees working on, giving great data for building AI models, not just healthcare, but all over. So it's been a fantastic journey in that ways to really come up here and talk to a group like, NASCOM. So just out of curiosity, how many doctors are there in the audience? Yes, it happens. So we have a talk about healthcare, and I just happen to be the only medical person. But that is encouraging for me because there is so many of, you don't need to be really a medical doctor to do work in healthcare. So what exactly, are some of the key items you see, on your table, on your plate, in your day-to-day work in healthcare?
Yeah. See, when we say healthcare, there are two clear branches that you can actually very clearly identify. There are many other, but when we talk about healthcare, particularly us, we see there are two areas where we need to cover a lot of distance. The first is the provider. Provider means the people who provide care. So people like Jaideep, the doctors, right, who save our lives. So you will find a lot of clinics, a lot of hospitals, they're actually providing the care to the patients. Then there is the second branch, which is the payer. So that means the people who pay for the care, right? Now, just to answer your question in a very simple one-liner, the automation, the IT, the AI, whatever we were talking about, that first started in the provider area. We started seeing all those hardwares. We started seeing those technologies. Actually, today, you provide an X-ray report or an MRI report, and the computer can actually apply the AI algorithm and probably do some diagnosis for something that can happen in the future. So it started at that level and where it should have started. And it did a world of good to the mankind, isn't it? In terms of surgery, in terms of, aiding surgeries and all that. But at the same time, what happened? We started moving towards a model where the patients don't pay when they need the treatment. We started moving towards an insurance model. If you see, even today in India, what used to happen 10 years back or 15 years back, or even today in cities like this, when somebody is falling sick, either somebody is a doctor in the family itself, your mom, your dad, doctor in the sense they know what to do. So we get the treatment there. Then we used to call somebody's uncle who is a doctor. Or you call the pharmacy nearby, or go to the pharmacy, get the things and all that. We never used to go for insurance when we have a regular kind of sickness. It was there only when you get hospitalized for a day, right? That's when you claim, the cashless and all those kind of stuff. Even that was not there, right? 10, 15 years back, even that was not there. In the US and in the Western world today, what's happening is, even for a small pill, you're having a toothache, you need some antibiotic or some painkiller, you need an insurance. You want to get your glasses done, you need an insurance. So what's happening along with this automation, the claims, authorization, that particular aspect where insurance is required to receive the treatment, that particular thing is going up. Now, because of that, we need more scrutiny, we need more regulations so that things cannot be misused. So, the biggest challenge that I see today in one liner, the people like you, they are not being able to focus on the clinical activities.
You're absolutely right, Mohar, because the way the systems have evolved over the decades, again coming from a Western aspect, there are a lot of administrative burdens which a doctor, a healthcare professional, nurses, it is estimated probably around 40% of the time is spent on administrative, non-clinical, non-patient related work, non-connected with the patient. So this is where AI brings breath of fresh air, a sense of relief to.
Because yes, there will be automation, somebody who was doing it manually, he will not be doing it, but at the same time, technology is going to generate jobs. Technology is going to generate, more areas, more avenues, more business. That is right. And that's what happened actually, if you see. But in healthcare, we have to bring in technology for only two reasons. One is the quality of care should be good and the cost should be controlled. Because when somebody is sick, if there is a cost associated with it, that adds to the sickness. So the responsibility of we technocrats in the healthcare area is little different. We always need to ensure that we are bringing in technology or bringing in sophistication at what cost, not for our business. Fundamentally, the humanity has to be put first.
Absolutely, and I really want to echo this thought and appreciate NASSCOM for taking a lead in this. So I'm also part of a NASSCOM healthcare community, and probably in the next couple of months there'll be a unconference on healthcare where we are trying to address this issue of universal healthcare. Now, right now, AI adoption or technology adoption is by these giants. The 8th richest company in the world is United Healthcare, and they are putting billions of dollars into AI, and just to make sure that people don't fall sick, especially people who have taken their insurance. That if the less people fall sick, the better for them. This exactly, I'm quoting their words, and. This is where it really, the dynamic shift is there in India, because for us, cost becomes a very, very important element. I have seen people die because of lack of money, and I really feel that AI and technology will help people to literally live.
I have visited hospitals, big hospitals, huge hospitals. I have been to the nurses and the doctors' chambers personally to kind of troubleshoot and understand their problems. You won't believe a nurse's chamber. I went there and I saw 2 computers and 8 monitors. I asked her that, what are you doing? Is this a surveillance unit or what is it? Now, what they are saying is, government is adding regulations. I told you the reason. And we are bringing more and more technologies. So their bandwidth is now reduced to only data entry and creating reports. In the hospital, I'm giving you an example. There is a hospital, there are only 400 beds. Can you guess how many vendors are engaged with them? A wild guess. There are 242 vendors. They are providing solutions. I don't know, 400 patients at any point in time could be 200 patients could be there. They have more technical people than the clinicians. Now that is happening because yes, the policies are being made at the highest level. Technologies are being made at the highest level. But people at the ground level also need to understand that the cost is in control.
Absolutely, and I think this is one of uh, the I'm all for Jugaad and Jugaad mentality, but in healthcare, what is happening is that we are just trying to take an old system which has worked well for
Very true.
past 2,000, 3,000 years, all the way from, we take an Hippocratic oath also from those times. This system, we are trying to just, put some more lighting and glitz and call it technology. I request this community here to actually come with more greenfield or more of a blue ocean, whatever name you want to call, strategies to solve the inherent problems of healthcare, and really appreciate the work which Mohar and all of you are doing towards that. And I think we are ending. I don't know.
Particularly the last thing I would like to tell you, I mean, AI and data, we can keep on talking. If you want, we can get into the algorithms also, but that's not the main point. The main point is we need to understand that the technology is such a thing that every 5 years it changes. Yes. So that people, if we don't adapt to the right technology, right, the cost goes up. So in the last 20 years, so many things have happened. The entire database stack has changed. The entire deployment strategy has changed. It has moved to the cloud native. Now the need of the hour is that we all need to keep our eyes and ears open in the technical field. We need to learn the new technologies, and we need to look for the new possibilities for automation. And we have to come up with packages which are cost effective and quality centric. We should not be doing what we know. That's a big problem, right? Somebody, a solution architect goes and he tries to design. He should not be designing something basis of his own knowledge. It should be on the basis of the best possible technology available to us. So that mentality is very much required in the healthcare sector.
Absolutely, absolutely. And thank you, Mohar. And anybody from the audience would like to throw up something?
So when you talk about technology in healthcare, there are two aspects. One is the management of the process management part of it, right? And the other is the tech part of it, the product, right? So, for example, if you want to do a tech on the product side, right? There are very few consultants who can help you with the clinical trials or what are the requirements to, enter the market. So how do you, for example, we are in Odisha. Odisha itself is a challenge to start a health tech product, right? But we are talking to people in Chennai, Bangalore and all. So we need to hire a consultant, right? And that's so damn expensive. So how do we mitigate that?
See, the consolidation of the resources. The most important thing is when you start a business like this, we don't even know what expertise is available where. And in healthcare, it's a very domain heavy business, right? You might be very good at technology, but you can't do anything, right? So I am facing the same problem. I have learned it the hard way. I myself, people tell me as a expert in healthcare, but I have learned everything on my own. So to answer your question, it can only be solved through dialogue, by socializing and having this kind of events, this kind of communities in healthcare. Because as I said, healthcare, there's a huge difference. Probably in banking and retail or in supply chain or ERP, you can find a lot of commonalities. But when it comes to healthcare, it's different. So we need to have more discussions, and we need to have more think tanks, and everybody would agree with me in terms of the preparedness to adopt new technologies and in terms of the sophistications available in this industry. This industry probably will be standing in the last. We see a lot of mainframe systems, we see a lot of Microsoft Access based systems rampant in most of the data centers. Yes. So it requires a special attention.
But yeah, I mean, breaking news is that there are a lot of doctors, there are lot, as in like probably less than 50 medical professionals in India who are actually working on providing you the answers that you are looking for and you are looking for. And uh, I have to apologize from my community for not reaching out in a meaningful way with like the non-medical community and form bridges. So the whole concept of doctors are gods and demigods and all that is like gone now, right? So we couldn't save the people from the pandemic with all that. So in that, right now, to answer your question, there is a small community which is available, which is active on social media, on LinkedIn. And please do reach out to us, connect with me. I can link you to people. I'm not selling myself right away, but still, in the sense, there are people available to answer the questions, and there are solutions already ready that you don't have to go through your own personal journey like that. But yeah, it's been a tough for me. I have been trying to push into this area firstly by coming out of my area. Now, if I stayed in my own healthcare community, I wouldn't been able to reach out also. So it's a tough journey. We live in two different planets, so we really need some interstellar, solutions for that.
Such is the apathy that if you go to a CDSCO or the FDA local, they would not know.
Yeah,
Go
they
to
won't.
Delhi.
They won't know. They won't know.
And I spoke to a consultant, through ILS, Institute of Life Science Bhubaneswar, one of the premier institutes. And they gave me the reference of a consultant. The first thing he said that you cannot afford me. So, what more can I say?
So,
Thank you. Just interest of time, I'll keep it short. So how are you looking at the mass personalization of health tech in the benefit of patients? Because we all understand the doctors per citizen ratio is extremely skewed in a country like India, where technology plays a relevant role in terms of personalizing medications for specific patient or categories of patients. So what's your take on that? I mean, we all know that technologies like AI and all can be extremely beneficial, and it can substantiate that mass personalization in the health tech sector. If you can, any point of view on that, please.
I think thanks to the initiatives from central government, especially with the Ayushman Bharat and the digital health mission, and the great example is the Arogya Setu app as well as the Cowin, which are huge, unimaginable successes, whatever be your political point of view. What these have proven is that you can, as a system, national level system, reach out to an individual. I request all of you to please go and get your digital health IDs and just try to pump in data into that, whatever be your interaction. So yes, we are at a nascent stage. Some people call it baby steps. I say we are still in utero, we are still to be born. But we are on the way. India is definitely leading the way in terms of universalization as well as personalization. Both are happening together at the same time. And that is something which no other country, even whether it is Estonia, which is the leader in digital health, or United States, or NHS is not to be mentioned, but we are doing really good. So we are on the way, we are reaching. As a community only, we can make it both universal as well as personal. So it's up to us, it's up to you and me.
Thank you.
Well, thank you all, thank you for your patience.
Thank
One more,
you.
is there? Just.
Actually, we are running behind the schedule. Can I request you
I'll
to,
make it
in the
short.
networking station, during lunch, you can have a one-to-one talk with
Just
sir?
a small question. Yeah.
The answer might drag the time, actually.
Yeah, no problem. Okay, all right.
Exactly.
No problem. Thank you.
Yes, that's why during lunchtime networking session, we can have a
All
better
right. You
discussion.
can log in the question I would like to ask, and you can have your answers after that.
Yeah,
no
sure.
problem. Sir, we have in the UN set by the Sustainable Development Goals, right? And we have good health and well-being. So how do you think this technology that we are talking about, AI and ML, how it is going to cater to that solution, good health and well-being, how we are going to cater to that? That's my
Sure,
question.
after the
Thank you.
break. Thank you.
Thank you so much.